talk about, because I've seen a young child, about 13, with hypertension. What could cause hypertension in such age group?
That's probably more likely due to a pathology, maybe in the kidneys or some part of the brain.
But it's not so common.
It's extremely rare, because those blood vessels, like we showed in that picture earlier, they're still fresh, they still work well. So it's unlikely that just out of the blue, someone would just have, a 13-year-old would have hypertension.
But of course, they also would need to be medically checked and be sure that everything is fine.
Absolutely.
Okay, let's go to hypertension in pregnancy. We hear, I'm trying to remember what name it is called.
Preeclampsia.
Preeclampsia. But before we go on, let's take this caller. Hello? Hello?
Hello?
Thank you for joining us. Please go ahead with your question or comment.
Okay, I mean, following up on the discussion on hypertension, it is very prevalent in our society today because a whole lot of people, young people, actually passing through a lot of stress. But my question is, what are the best institutions in the country? Because I've come to find out that one thing is diagnosis, the two is management. You know, people are able to manage it and live through it. In sane societies, people actually do live with hypertension and live as over 100 years and survive it. So, but in our own case, it is not detection. It is management all through the lifespan of the person. So where, for example, in Lagos today or in, around the country, where are the best institutions for?
Okay. Before we take the break, you can quickly answer to that.
Yes, that's a great question. I want to give a big plug because there's an institution, a hospital called First Cardiologist Consultants, which I visited yesterday.
Okay. But there are Lagos, for instance, Lagos University Teaching Hospital,
yes.
Lagos State University Teaching Hospital, and I guess even private hospitals.
Private hospitals,
they should be able to handle, you know, the management of hypertension. Doctor, let's talk about unchecked hypertension and the consequences that can come along with it.
Yes, that's a great question. If you think about a water hose is meant to take a certain volume of water at a certain pressure. Over a period of time, as you use the water hose, eventually you begin to see what? You begin to see cracks in the wall, and then eventually the water begins to kind of leak out. That's when you know that this is a problem, that we need to replace the hose. Well, our blood vessels, our arteries, our smaller arteries called arterioles are like that most of the time. They are built to only withstand a certain amount of pressure from the heart. So if the pressure is constantly higher than what it should be, 140/90, if the blood is constantly flowing at that kind of pressure, what happens is that, again, looking at that picture, the lining of that blood vessel begins to get eroded. It should be silk, the lining should be smooth and shiny and healthy. But because of the high pressure, it begins to tear open and actually cause damage to the inner lining. But the body responds by doing what is known as inflammation to try and heal that damage. And that's when you begin to see these scar tissue and plaques and cholesterol buildup begin to happen. In addition, in parts of the body where are very sensitive to blood pressure, like the kidneys, the brain, the heart, other parts of the body, you begin to see some what they call micro damage to the body, to the body. As a matter of fact, hypertension is the #1 cause of kidney disease.
Okay, hold on, doctor, please. We have Tracy on the line. Hello. Sure. Oh, I think we lost her. Please try and call back.
I mentioned that hypertension is the #1 cause of kidney disease. Diabetes is the second highest cause of kidney disease. We're seeing an epidemic of kidney disease in this country, where we have the dialysis centers full. I mean, we're talking about 2, 3, 4 months, almost 6 months waiting list just to have proper treatment. So it's not something that should be, as they say, sneezed at. Uncontrolled hypertension is, as you said, silent killer. We need to have it under control at all costs.
So even heart attacks and strokes?
Of course. Okay. Thank you for reminding me. Of course, the scariest part is the hypertension. I'm sorry, heart attack, having a heart attack and stroke, because as we saw in that picture, eventually those blood vessels are becoming fragile and more compromised. So once it gets to a certain point, the tipping point, so to speak, there could be a rupture, which maybe in the brain, which is called a stroke, and there could be blockage in the brain or in the heart. When the heart is called a heart attack, again in the brain it's called a stroke. So yes, that is what eventually we're looking at. But even before you get to a heart attack and stroke, you already begin to see problems with your eyesight, with your kidneys, with your functioning. So don't say, all I'm trying to do is avoid a heart attack. It's important, but you really want to be healthy.
Yes, as we have it on the screen now, on this side is a heart attack picture. That is on my left.
Right.
And so on the right is the stroke picture.
Right. So just want to point out that the darkened areas, you see normal healthy heart tissue on the left, but you see that square, and then just below the square you see is darker than the rest of the heart. So that's obviously what has happened there, is that the darkened part is the part that has...
And we don't want to get to this point at all, because a lot of people, as the other caller, that's James, said, people live, to their full age before, even with hypertension. So we need to get hypertension early and control it. Adebayo is on the line. Hello? Okay. So we don't want strokes to happen. We don't want hypertension, we don't want heart attacks to happen. We don't want it to degenerate into diabetes and any other medical condition. What should we do as individuals?
That's a great question. I'm going to talk about some general pointers, and then secondly, I'm going to focus on black people in particular. So obviously, for cardiovascular health, not just hypertension now, you need to have your weight under control. We tend to gain weight a lot for some reason. So weight, and there are certain parameters that they use. Sometimes they say for a man, your belt size should not be more than 40 inches. Well, bottom line is that you need to move. You need to move. You can't be sitting down or lying down all day. In fact, WHO says that if you sit down for more than an hour each day, you are at a risk of cardiovascular disease. So you want to move. You want to also diet, and I believe diet plays an even greater role
in this. Okay, let's be joined by this caller. Hello.
Hello, this is Akil from Ajibade.
Thank you for joining us. Please go ahead with your question or comment.
Please, I would like to ask the doctor, is there anything related to hypertension about cardiomega?
Sorry?
Cardiomega. That is when they say to your chest, your heart is wide, too large, enlarged.
Cardiomegaly.
Related to hypertension.
Yeah.
Okay, thank you, Akim.
I think what he's referring to is cardiomegaly, so an enlargement of the heart.
Is it related to hypertension?
Yes, it is, very much so. Basically, the heart, if there's a lot of hypertension and the blood vessels are constricted, the heart is trying to pump against a resistance. So when you're pumping against resistance, it's harder and harder. What happens? If you're building muscle, your muscles begin to, if you're lifting weights, your muscles grow bigger. Same thing. The heart is pumping against a resistance, it tends to get bigger, and that's not a good thing at all.
So you were talking about diet, the role of diet.
So what we want to do is we want to take foods that help to heal and maintain a healthy blood vessel, especially the inner lining. That inner lining is called the endothelium. We know certain things help and certain things...
like this leafy vegetables?
Leafy greens. What is that? That kale? Okay, well, this is a great slide. It's a great picture. So peppers, you want as vegetables,
as much green as you can grab.
Greens and the other colors, the oranges, the reds, and all that. Plants tend to have certain chemicals in them that are protective. They're what they call cardioprotective. So they help to heal the blood vessels. Something like garlic too, although there could be a problem with body odor and all that coming out because of the garlic. The rule that is given out is that you want things that will help to boost what is known as nitric oxide production. Nitric oxide is produced in the inner lining of the blood vessels, and like I said, these plants, especially things like garlic, beets, some other terms come to mind. but they help to boost the amount of nitric oxide. Nitric oxide, what nitric oxide does is that it helps to heal the blood vessels and it helps to dilate the blood vessels. So that's a countermeasure to hypertension. Foods that you want to avoid, obviously you don't want processed foods. It's becoming a big thing in the Western world. Everybody's taking fried foods. Those foods are loaded with...
Even here.
Even it's getting more and more here. They are loaded with salt, sodium, which again, we black people are not very, we don't handle very well. You also want to avoid fried foods especially. I mean, not saying you should stop it altogether. You want to avoid them as much as possible, because when they are frying the foods, the frying and the heat in the oil, it creates very harmful substances, again harmful to the inner lining of the blood vessels. So you want to avoid those. You also want to avoid excess protein. We are big meat eaters here, unfortunately. So you want to try and reduce that, and you want to avoid the whites as much as possible.
The whites meaning?
The whites meaning, and I'm sure I'm going to get in trouble for this, white bread, white rice, white sugar. Okay.
Avoid as much as possible.
You want to
of course,
reduce
not to stop it completely.
Exactly. Well, we can't. I mean, we're in Nigeria, right? This is part of our table food. So things that help to raise your blood sugar levels are things that I'm saying we should try and avoid, because once you begin to raise blood sugar levels, the body in turn begins to react, and then it can cause damage to the inner lining of the blood vessel, and that's what you don't want to happen.
We don't want it to happen, so we should all make it a habit to check our blood pressures all the time, because it might just be that stitch that saves the night, right?
Right.
Thank you so much for coming on today on Health Matters. We've been speaking with a medical practitioner, health educator, and executive director, Brain and Body Foundation, Dr. Dayo Ajibade. Thank you.
Thank you for having me.
And thank you also, James, for calling, Akeem and Tracy. Thank you all for being a part of the show today. Let's make it a date next week. I am Yomi Otaibe.